We're live.
I know, it's pretty neat.
What's that? I tried to have Dax film something, it didn't work very well.
Okay, we are live on Moms, we are live on Pelvic Floor, and we are live on YouTube. And my daughter is going to take the reins on this phone. Could you keep it on me just for a second, sweetheart? Because it's, yes, awesome. Okay, so as we go tonight, we're gonna be here for an hour. You have plenty of time to ask questions. Ask away. Anything you wanna know, anything you wanna see, we're gonna do everything. Ear, sinus, and jaw. Dr. Alyssa here is going to be doing some dry needling, and you are in the picture here, which is great. Look how nice that is. We're just gonna kind of move around the office. We're gonna go through product. We're gonna show you how to clean the humidifier if you want to. I have one soaking and taken apart and one that is not. What should we start with? Anything you guys want to request first, as far as sinus or ear or jaw? Any requests? Anybody? I feel like I'm calling out in an auction. Anybody? I think then we are going to start with jaw, because when I was asking people throughout the day today, it was all jaw where they wanted to start. So why don't we head on into the pelvic floor room?
Do you want me to?
Yeah, that'd be great. Thank you, sweetheart. Okay.
All right. My YouTube, we are going into, we're gonna go into the room.
And this is Mally. She's amazing. Hi. Yeah, go for it.
Okay,
Here, I'm gonna send past you.
Melly, come be our wonderful patient. You can actually, I'm gonna move this over a little bit. Space. Why don't you lay on your side facing that way? All right, so for the PT side of things, we're gonna do some dry needling, and dry needling is a technique that uses small little like acupuncture needles to go into the muscle belly to help release muscle tension faster. So it can be a really effective tool for TMJ jaw pain, because a lot of times part of the issue at least is muscle tension, and so needling can help address it. So I left my needles over here. I'm not thinking about the wall. So,
Avery, do you want to just type in starting with dry needling so they know?
In the comments?
Yeah.
well, yeah, so you obviously know what to expect. You've never had it on your face though.
No.
So. I'm not going to stim it because
This needs
so we're just going to put the needle in and let it sit for a minute or two.
Okay.
So a lot of times I will needle masseter, which is like that biggest muscle on the side of your cheek that I feel like everyone's like poking at when they have TMJ stuff. There's other spots we can needle that can help also, but we're just going to stick with masseter today just to keep it simple and easy to see what we're doing. Mally's had needling before, so she knows what she's in for. But when you get needling, usually there's like some achy soreness when the needle goes in. We don't want it to be like pokey, needly, because it just doesn't need to be. So if it is really pokey for people, I'll usually move the needle. So I'm just looking for where that muscle feels tight. Your face is so, you make it look so comfortable. So with other places in the body, sometimes I'll use some electrical stimulation to kind of stimulate that needle to help that muscle tension leave faster. In the face, I almost never do that just because it's your face. So a lot of times what we do is just leave the needle in for a minute or two and then remove and find another spot. So I'm taking it out. You can see your face as the needle went in. I could feel a nice little twitch in the muscle. Did you notice that? Could you feel that?
Yeah.
Twitchy?
Yeah.
I'm gonna do one more because I can, and might as well treat your jaw if we're gonna really treat it. Other, like, when we're talking about sinuses and all that kind of stuff too. Jaw obviously is going to impact drainage and that kind of thing, but also I've needled like suboccipital, some of those things at the base of your skull, the muscles at the base of your skull, the upper cervical muscles, that can help with sinus stuff as well. So a lot of these muscles around the head, needling can be helpful to impact sinuses and drainage as well. So, and I mean, TMJ is also so related to our posture and that kind of stuff. So upper traps and other cervical muscles, again, can impact TMJ as well. So, questions?
I think we're good on questions so far.
Does that feel like I covered the basis? Melly, you stay here a second. I'm gonna go grab some cups. We were just kind of like, I like to use cups and dry needling in the clinic in terms of like the PT, pelvic floor side of things. And so we were playing with, oh, thank you. We were playing with how can we use cups. Jess, could you grab me the magnesium lotion as well, please? In the context of
I love that.
jaw, in the context of sinuses and jaw pain and things like that. And I was like, well, let's just try some cupping by there. And as we were doing it, it's like, oh, this is actually probably really nice for distraction and facilitating drainage. So I'm gonna do a little bit of that, and you can kind of tell me how it feels.
Okay. Plus, we love magnesium lotion for all things anti-inflammatory. It really, really helps with achiness. And then, of course, it helps with cupping. And for those of you who have cups at home, I mean, this is definitely something, if you're comfortable with your cupping skills, that you could facilitate.
So I've cupped on my face before and given myself bruises. Jesse knows when this happened. I mean, often you'll get bruises from cupping, so you have to decide for yourself, like, how much do I care that I might get a little bruise on my face? I didn't even ask you if I can bruise your face, but I like to think about having it kind of like right by the tragus, like right by the opening of your ear, just because I feel like that's where it feels like we really want to pull and open and whatnot. So, and then a lot of times I just kind of pull the cup away from the body to get some distraction and opening.
Is there a reason why, because typically during cupping you'll see like sliding cupping, so going up and down the muscle, is there a reason why you would want to do more distraction rather than like slide cupping along the jaw?
Again, in the jaw, I was really just thinking like, let's not bruise all over someone's face.
Sure. Yeah, little
really,
things.
Really
okay.
that, yep. If someone is like really restricted in their jaw, yeah, like some slide cupping would be a really good idea for more like fascial release. Again, we were just kind of playing with it and thinking about that like actual like physical manual opening of like that external ear opening and getting drainage that way. But you certainly could throw some little cups and sliding across the face too. So
could you show just a little bit of sliding, maybe on the other side, so that we keep it as even as humanly possible?
Do you want to do the other side? Go
Sure.
ahead. Do the other side.
Do you have a side that's tighter than another, Allie?
Not that I noticed.
Okay.
Well, that being said, do you want me to needle your other side too? Do you get a lot of jaw tension?
I notice it sometimes, but not like all the time. Not something I've ever had a problem with, I guess.
Okay, fair.
I feel like when patients deal with jaw pain, they get a lot of clicking. Like that's what they describe to me is the clicking. Like they want the clicking to go away. And then of course it comes with tension and some discomfort and pain as well.
Well, I'll say oftentimes if we're dealing with some chronic neck pain that just doesn't seem to quite go away, looking towards the jaw can be a nice puzzle piece to help unlock the neck tension, getting the results a little bit faster.
Mm-hmm.
So this is what I would do. I'm getting my hand in the way only just so that I can kind of brace and stabilize the tissue that I'm trying to slide against, but this is what we would do. And again, usually with cupping, no, this is like a pretty small cup and like you can't get that much tension on the face just because of small areas, small tissues and whatever, but you will often get bruising. So you have to decide for yourself how much bruising you might want to have on your face. But like with this, I mean, it's red right now, but like I don't think you will actually get any bruising from that. But
I didn't bruise the other day either.
you didn't.
Mm-mm.
It's good. I was trying to be so gentle with the cups on my face. They're actual like facial cups. And I just had like little bruises all over my face, but it's cool. How'd it feel?
Good.
Did it feel loosening? Did you feel any like opening your ear or anything like that?
I feel like with the needles I did more than that. But it does feel easier on this side too.
Are you up for the chiros jumping in and doing our jaw stuff now?
Yeah, sure.
It's just more body work.
Sure.
I'll take your glasses for you.
Switch you.
Thank you. Yeah,
Okay, let me just get this guarded.
one of our docs is holding a baby. So let's do the, oh, you'll switch with, okay, perfect. Melly, you're an amazing patient, as is your daughter. Will you hold her here?
Yeah.
Okay. I'm jumping in?
Yeah.
Okay.
Oh, I don't know.
I love it.
I just
jumping in.
assumed that
I'm
that
jumping
was
in.
what we were saying.
Go ahead and
but-
lay on your back.
Do you want gloves, Jesse?
Yeah, I do.
I'm gonna make some up there.
Okay, I have the biggest hands in the office. I'm the only one that needs like large, extra large gloves, so these may not fit me. I don't
And
know.
those are like mediums and they're like too big for me.
Well, they're okay right now. It's when I'm between like using lotion and different medium, that I have a really hard time getting gloves on, but this worked. I'm Dr. Jessie. I am on the chiropractic side. I feel like this work in conjunction with the PT side of things that Dr. Alyssa does, it works really beautifully together is what we're finding. Not a lot of places do a ton of jaw work, and this has kind of grown in the clinic because of the request from the women in our clinic. This was not our top priority when we started this place, but it has naturally turned into one of our biggest things that we work on, and we're constantly working to add in different techniques based on what we're learning for the jaw. And then again, it can lend itself to help with the upper neck pain, which is really interesting, where sometimes people will have stuff that they can't get rid of, like that migraine territory or like the really tough pain at the base of the head. This kind of work can really help facilitate movement in that area and less pain. But the combination of the two different modalities is incredible. We now have a specialty appointment just for jaw and ear sinus drainage for this reason, because it gives patients a lower price point, a shorter appointment, and they can get a lot of work done, and then they could just hop over to PT and do this, do what you just saw as well. So something we're just constantly listening to with patients. I'm gonna be back to you guys a little bit. Here we go. Yes. Okay, so a lot of our work on the chiropractic side is internal. I want to talk a little bit about the tensor belli palatini. There's a muscle in the back of the mouth that basically when it activates or when it contracts, it physically opens the eustachian tube. The eustachian tube is that spot that houses all of the fluids. So although I'm doing jaw here, I'm also in the territory of ear and sinus drainage. It's why all of this works together. I'm even going to be getting into lymphatic drainage with jaw naturally, because I'll be working on this area. So they go hand in hand always. But specifically talking jaw, aside from that muscle I just talked about, I'm going to be going into her mouth here, and then I just have her relax it. And then what I do is I traction downward. And sometimes it's in a different direction based on what I'm feeling with the patient. And then what I will do is give her a break to swallow and or hand her a tissue. So I am going to do that, because what happens sometimes with this particular maneuver is patients tear up. It's a natural response, not because she's in pain, but because her body will just do that. So then I go back in and just lengthen through here. How's the pressure? Good. Good. Beautiful. Okay, the next thing I'm going to do, I'm going to still have my finger in her mouth, but instead of my hand being here on the actual joint space, I'm going to be in her ear. So I'm going to use one of my fingers here to actually circularly move around the ear. And what happens when I do that is I actually push the joint forward. Like I can physically feel the joint on the inside of the mouth. It's incredible for articulation, especially for those clicking patients. It's a huge, huge relief. And it feels really good in the ear. So again, it'll help with ear and sinus drainage, even though we're working on jaw. And this was actually Dr. Jess's maneuver that, like, she brought this to our attention because she works on babies with the craniosacral therapy. And this is one of the things she was doing with babies. It's a little lighter with the babies, but it's the same idea. So this was something that she actually came up with, and the results are awesome. So I would be in her mouth here, relax through, and then in her ear here. And how's that pressure-wise? How do you feel? I mean, like in general, felt kind of nice. Okay, then I'm gonna go and give her a big old smile. And she's just gonna relax her jaw, and then I'm going to be here for the sphenopalatine ligament. And she's just gonna relax. And I'll be here for another 5 seconds. It doesn't take a lot of pressure. It's a pretty tender area. So you do have to be careful not to overdo it with patients. Not that I'm talking to doctors necessarily, but it's good for you guys to know you're allowed to say that that's too much, right? Can you scooch this way a little bit? I'm gonna see if I can get around here. No, it's okay.
I moved it for my own purposes, but
do you want me to move it? No, you know what? I might see if I can go over you.
Okay.
Is that weird?
Oh, that's
Okay, I'm just gonna be here. Okay, so on this side, I'm going in, same idea. And I'm just tractioning down. And you can relax your jaw even more. And then I'm gonna let her take a break. Beautiful. And then same thing. So we're just gonna traction. What's really interesting about the jaw is it's one bone, 2 joints. And the joints themselves have a disc in between them. So they're a little bit like the spine that way. I mean, they don't really move like the spine, but it's a similar idea, but it's what makes it a tricky joint. Okay, so I'm gonna be in your mouth on this one and in your ear. So I don't know if you can feel it, but your jaw actually like moves forward when I do this part. Isn't that incredible? So then I give her a break. And now I'm gonna get into the mobilization. So because of what Dr. Beadle has been working on, she talked to me most recently about a lot more mobilization. And so that's what I have started doing now instead of like a quick adjustment movement. With jaw, the quick doesn't seem to make as big of a difference as when you're really mobilizing the joint. So that's what I'm gonna do here. And what I'm gonna have you do though is bite up just a little bit so I can see where you're articulating. And so it feels tighter to me on that left side. I don't know if you can feel it, but that's where I'm gonna be. So I grab onto her jaw and I physically, you can probably feel that kind of gapping. Pressure, okay? And I'm kind of focused in on that left side. And we're just basically decompressing that joint, which is really, really cool. Now I'm gonna do the outside work.
Okay.
All right, this will be lotion. And actually, you. Any questions on any of this on the live side of things? Are we good for questions? Okay. Okay, so with this part here, I'm gonna go on this side. I'm gonna be under her jaw. Now, this area is full of lymph nodes. So again, we're working on jaw here specifically, but we're also getting into lymph, which is where we house all of the extra fluid with our ears, our sinuses. So this typically feels really good, but then it's, you know, killing a couple of birds with one stone. And then what I'm gonna have her do here, you're gonna open your jaw. And yep, beautiful. Just like that there, and then do it again. And close. Beautiful. And then we get into more of the actual muscle work on the neck because all of these are very much attached right up into that joint space. So I'm going to move through this SCM and all of her breathing muscles, all of those accessory breathing muscles that pull us forward every day. And so this ends up helping to really relieve some of the pressure in the joint space How's the pressure?
Good.
Good. And then same thing other side. We keep things pretty even side to side. I mean, we're always listening to like, you know, whether or not you have an issue on one side more than another, but typically with most things we're doing in the office, we're keeping things pretty even. I'd say we all do that. And then I just traction up. Okay, any questions about that? How do you feel?
Great.
Amazing. We like great. Okay. We're gonna head to ear and sinus drainage. So let's go into the other room. You guys can all follow us. You good?
Yeah.
No? Okay, cool. You're like a new job.
Yeah.
I think I'll just have you sit maybe here.
Okay.
Go ahead. You got it, girl.
I feel like I'm gonna have you do this part. And I'm gonna take over.
I just set this down real quick. Sorry, I'm just gonna. All right, YouTube, I'm coming all the way back up here.
Just come to my house all the time. But I was like, Jessica, just calm down.
I know, she is.
She's
She's
just come.
I know. It's amazing.
Teach me everything.
It's amazing.
All right, okay. So for ear and sinus things, for ear specifically, we love to use a lot of like natural oils. And so we like both, having both in hand, just because they do have some sort of slightly different ingredients. The Earthly brand has, let me just recap here, mullein leaf and olive oil, and the garlic mullein has just a couple more ingredients that are all natural as well. Garlic, super natural, antibacterial, both of them will do the trick. And especially if you're using the mullein leaf oil at home for an ear infection and it's just not working anymore, try the other one, because switching products every once in a while is not a bad thing, even though they're both natural. And so basically what you're gonna do with this is if you're having any sort of like congestion, ear pain, any sort of redness going on in the ear, you can use these for yourself. And so, are we putting it in?
Actually, I was thinking more.
What are we doing?
I was thinking more drainage, and then, but we could put her back on the table.
Oh yeah, no, never mind.
Yeah.
Okay, so, but when they have active ear infections, when you have any sort of like fluid buildup in the ear, especially with congestion, then we're gonna do a little bit more of the ear drainage from the inside of the mouth. It's gonna go in your mouth again.
Okay.
It's gonna be fun. But you can use these in tandem as well, just for extra support to help with that pressure equalization in your ear. So,
And if any of you guys want to see that after, let us know on the lives. If you want to actually see that.
yeah, but basically what we're gonna do, we see, Abby and I do see a ton of toddlers into the early childhood phase where congestion is a huge, big thing, especially going to daycare and bringing home all those little bugs that we love. And so if your kiddo is having a lot of this congestion, doing this at home and learning how to do it is super important, just to help them get rid of that fluid faster, hopefully prevent like ear infection after ear infection after ear infection after ear infection. But again, take that as we come, okay? So basically what we're gonna do is there's the eustachian tube right here. It is like the exit point for all of the sinuses. And so we're gonna go inside the mouth to target it from the inside. There's a little hole that lives right on the inside of that tube that when we stimulate it, it helps to drain because there's a lymph node that's right there as well. So if your kiddo is sick, on kids, you'll be able to feel a lymph node about marble size. And sometimes it's pretty hard where you can actually feel it pretty good. Adults is a little bit more trickier just because our face is a bit bigger. And so if you are super congested, super sick, you should be able to feel that lymph node as well. But if you don't, that's okay. You're sweeping in the right spot still. So totally fine. But basically what we're going to do is we're going to go back inside the mouth. I'm going to grab you a tissue just in case before I do that.
Callie, have you had this done before
No.
either? Okay.
Okay.
So
First
this
time
is-
reaction.
Yeah. Well, and there's a cranial nerve reflex that's going to make you gag potentially.
Okay.
Yeah.
Totally normal.
Gagging, coughing, totally normal. So
Okay.
totally fine.
Sounds good.
Okay, so I'm going to go back behind the molars and we're going to go back here and we're going to sweep. How's that feel?
Good.
Stimulation wise, do you feel things like moving a little bit? You can say no.
Yeah, I guess a little. I don't. Yeah.
Let's do it a little bit more. So we like to do, yeah, it is a little slow. One more. So we're gonna go back and sweep that hole. Okay, so it's behind the molars. Yeah, basically anywhere behind the molars is a good spot. Yeah. And you're gonna gently sweep.
And again, back to that tensor veli palatini, that muscle that she's kind of digging on. When you move it, when you sweep it like that, it would be the same with your baby. You're opening up the eustachian tube. So you're physically draining the fluid downward, kind of out of that canal, like out of the middle ear, basically. Well, middle inner ear.
And that's it.
The other thing I'll add to when you're dealing with babies, their tubes are like
More horizontal.
horizontal. And so they're not as capable of draining as adult ears. And that's why helping to facilitate the drainage is so important for these little ones, because they can't do it as naturally as we can as adults, which is just another reminder as to why it's so important.
And if your kiddo is having an active ear infection and you are doing antibiotics, that's totally fine. But another thing that you can aid with it is tea tree. And so tea tree is a natural anti-inflammatory, so it can help bring that little inflammation down, whether they're going through an active ear infection. And so what you would do is, for kids, I would definitely dilute it with water just because it's pretty strong. But with adults, you can definitely just put 1 drop on a cotton swab, and you're gonna go right behind the ear, right about on this masseter place right here. And what that does is it's gonna help with inflammation and help drying it out from that middle ear infection, if that's what you're dealing with.
Do you want to do the lymphatic drainage? So lymph nodes too, just while you're setting up, I'll talk. I think we forget how important it is to drain lymph nodes when you're dealing with any type of sinus or ear infection, or you're kind of on the cusp, because your body holds any amount of inflammation or infection in those lymph nodes. And so you have to be working to drain it. And lymph sits very superficially on your body. So if you're going to be doing this, it's very light, which makes it really, really nice for kids. So you can actually do a ton of lymphatic work to help clear the ears, to help clear the sinuses. It's not going to do it immediately. You have to be doing this often, but you can do it just lightly, a few sweeps, and then you can do it an hour later. Lightly, a few sweeps, so it doesn't hurt the kids. They like it. And it's draining the lymph, or like the fluid, the excess fluid that your body is creating out of your body, which is incredible.
It's a really nice face massage.
Yes,
And
it
so basically what you can do with yourself or with whoever you're working on is you can gently tap along the forehead, or you can just kind of do little circles, whatever really you want type of thing. And then you're gonna sweep a couple of times above the forehead just to kind of get that fluid motion moving. And then you're gonna go underneath the eyeballs. You're gonna kind of stimulate. You can do gentle taps. You can do some sweeps just to get everything in the nose working. This one you'll probably feel a lot more if you're congested. And then just after doing a couple of sweeps there, you're gonna go down the face just to kind of help drain everything out of the face. And then I'm gonna kind of stimulate underneath the jaw here, because we do have lymph nodes that are underneath the jaw, and just kind of massage in those little soft pockets as well. So again, very, very gently, not hard at all, but just lymph drainage. And then down from the back of the ears towards the collarbones. Excuse me. And then after doing a couple of sweeps from the back of the ears down towards the collarbones, you can stimulate above the collarbone and below the collarbone, because that's our exit points for both sides of our bodies for the lymphatic system. So just kind of getting those stimulated, and then you'll feel it. Feel it good.
How do you feel?
Really good. Yeah. I have a little bit of congestion, so it seems like.
And this is perfect.
I could feel that when I was on the inside of her mouth. There's just a little bit of congestion going on.
Do you want to adjust her ears, maybe?
Yeah,
Just to...
absolutely. So when we're adjusting the ears, this also helps with getting more of that equalization pressure, that fluid draining a little bit easier. And basically what we're gonna do is I'm gonna grab the earlobe and we're gonna do a little J hook almost. And so I'm gonna be here and a little tug, just to kind of help open up that eustachian tube. I might, with my adults that are like super congested, I might do a little bit of cranial work and just like hold that position back just to help with fluid drainage, and especially with kiddos that are dealing with any sort of congestion. Abby and I definitely focus on this quite a lot just to help with that whole overall head structure to help open everything.
That was amazing. I think we're just gonna run through product. Do you wanna do a handoff and then you can stay if you want?
Yeah.
You're welcome to go together. Okay, so what's your over-under then? I mean, I know you didn't plan on being put on the spot, but like, what is your over-under on all of this? Because it's a lot. We've never done any of it.
Yeah, it's good. I would do it if I was like dealing with sinus stuff, a lot of congestion. I definitely come in.
Do you feel though like you would be comfortable doing this at home with kids? Like, is it
Yeah.
that type of thing? Like, do you have a lot of these kinds of products? Do you already do some of this stuff?
I've never really tried much of it with Henry, which I'm gagging you. But he did have tubes when he was like 9 months.
Okay.
So I wish I probably would have tried some of it more. I think I just like wasn't really sure what I was doing. So
Well, and that's actually a nice segue for people that are getting tubes for their kiddos. This is still tremendous because sometimes tubes don't work too. We've had a lot of kids or like families where the kids will end up with 2, 3, even 4 sets of tubes. You can definitely be doing, I mean, you should be doing, or you can be doing this type of work even when kids have tubes. So don't forget, like if you're still seeing some gunk come out with the tubes or they're still struggling a little bit, this stuff is wonderful, even with tubes, even with antibiotics. And we like using all those things together because it gets a better outcome.
his fell out. So now
Oh,
I'm like,
perfect. Okay. Yeah. Yeah.
Well,
Spot on. Yes. Okay, we're gonna run through some products and the humidifier. Humidifiers, again, it's really, really important this time of year. Do you guys want to see this first, or do you want to see the products first? And does anybody have specific questions on products? Anybody online? Questions? Melly, do you have any questions on products specifically that you want me to?
No.
Okay.
I just listen to what you
Okay,
got.
perfect. We have we have a storefront that just has everything that we stand by. We try to keep it really simple. So the idea is not to overwhelm you with product. It is to give you some of the basics that are tried and true so you can start somewhere and then you can always add on from there or subtract with kids because everybody has their preference, right? And my daughter's here, so I might even ask you some questions on the things that we've done that you like or don't like over the years. And they have definitely grown into liking the drainage. They didn't like it when they were itty bitties, but it works. So now they will actually come to me and ask me, which is super cool. Okay, one of my favorite products, I can't make this up, it's wet because we turned it. So this is really cool. It's basically a saline nebulizer, but you can take it on the go. So if you see this, I don't know if you can see the steam.
Yeah, you can see.
It is so cool. And saline, like this, not only helps hydrate, but then you have that antibacterial component from the saline, from the salt part of it. This is really nice for a purse. This is really nice to take on the go because who can bring a nebulizer anywhere? Who really owns nebulizers? Most people don't. So this kind of a thing is really, really nice. It's just saline, so it's just salt water basically. The other thing that you can use, and this is just one of the refills for it. Another thing you can use are these misters, right? I like these better than actual sprays. You can decide what's best for you, but as far as my kids are concerned, do you like this better than the spray?
Yeah.
Yeah.
Well,
It's just-
wait, what is the spray?
Well, I know you probably we haven't had it in the house for a while. It comes out a lot faster.
Oh yeah.
Like, it's
yeah,
a-
what you're talking about.
Yes, so this, I mean, I'm sure people have seen this before, but it's lovely. And it's just saline. So again, first product, you can just keep it in there. And I would honestly, if you're doing saline, if you're needing to dry passages out, I would do this every hour. I would do it all the time, just quick. Like you could even just run this on a kid. How long are they gonna last? 5 seconds, tops, 10 seconds. But if you do it throughout the day, like that, you are gonna get an effect, right? So you don't have to do it for long periods of time. You can do it in short spurts more often. This is funny, I brought my own swimmer's ear in because every time we travel, I bring swimmer's ear because preventatively it dries out the ear if we are traveling in water, like if we're at a pool, if we're at the beach, if we've gone down to Florida. I learned when they were young that ears get pretty clogged when you're on planes and then you're in the ocean. And so, or you go to the cabin, right? And they're under the water doing the handstands. This stuff is tremendous just for drying things out. Once you have more of an ear infection, it's not awesome, but it's great for drying things out. So I just bring it. Question. Yes, I love questions.
We use the saline at home, like that's great. I almost feel like a neti pot and I hold it in there for a while until it drains out the other side. But you're saying that you
can do both.
mist it in there?
I also use it like a neti pot.
And I do personally use it like a neti pot.
Yeah, I forced
And I think I'm thinking kids.
Yeah.
I use it, yes. So what Alyssa said, what you do is you hold it in there for a while and you almost feel it. You can like switch sides. You can feel it physically move in the cavity. And then you're treating it more like a neti pot where you're like transferring the water across. Go for it.
Are we talking about the saline spray or the eardrops?
Oh, saline spray.
Yeah, I was thinking
Thank
like
you.
eardrops to go in and then out.
Oh, yeah, but we'll get into that. But this is, you can use it more like a neti pot, but you can also use it just as a quick spray because again, it has antibacterial properties and that salt is gonna dry out sinuses. So I think however you use it is a win, but I'm spot on. And funny enough, I don't really like neti pots. I've talked about it in here. I think they have absolute merit. However, if you're not careful with the type of saline you're using or how you're using it, it can almost create more of an infection. So you do have to be really careful. You had thoughts on this too, right? We kind of talked about this.
Yeah, I accidentally used it with non-distilled water.
Yeah.
Bad choice.
Yeah.
I think I really messed with my sinuses and I'm not even sure if they're normal yet. So.
And so we actually lean away from neti pots. And you'll see even in our storefront, we have like a little kid version so that you can kind of push some stuff if you feel like you need to. But I kind of save that for last straw. If you can just get away with this, it's awesome. Okay, getting into the earthly, the earache ease. It's what Dr. Jess talked about. I love this. However, if you are clogged already, so this is like great for infection and inflammation, but if you're clogged and you feel like you're underwater, where are my drops? I had them. The Highlands earache drops. It has belladonna in it, which we all know is deadly nightshade. But I'm kidding. I mean, I'm not kidding. But it works wonders. It's natural. It's, been around forever. But it's wonderful for taking the pressure off when you feel like you're underwater. Oh, I don't know where it is. Okay, we had it. They're it's called Highlands, Hylands. You'll see it at Target. You'll see it anywhere, that brand. They have a lot of products, but this particular product is just for kind of drying out the ear, and it changes the pressure. And so we're going to get into that now with pressure change on the ear. When you add water, this is an old flight attendant trick. When you add water to a cup, and typically for kiddos, we're going to say to use a silicone cup so you're not dealing with the metal and it's not getting too hot, or the ceramic. But what you do is you fill it with water, and I'm not going to heat it up right now, but you fill it with water, you heat it up to almost like a boiling point so that there's steam coming off. And what you do is you put your ear over it, and you can be off the cup, right? Because if it's hot enough, you're probably not going to want to be down on the cup, but you lay on the cup like this, and it will physically change the pressure in your ears. It's why it's a flight attendant hack. My mom was a flight attendant, so this was something they did on the planes, but it's because you need that pressure change to get movement and to take, again, the pressure off the ear so you don't feel like you're underwater. So that is an incredible trick with kids. We've done this a lot with Reagan, haven't we? This one, and it works. It feels really, really good for kids and adults alike. I feel like that's kind of what I have for product. We don't keep every product in here because naturally the things that we're doing with patients aren't going to be the things that we're doing at home. If you have specific questions about a specific product, do let us know because we have answers, and we're always looking into things, and we're really open-minded with the things that are out there and what people can try for their ears and sinuses to get relief. Now, I'm going to get into a humidifier. You don't have to have this humidifier, but I do recommend for all of you parents out there to get a humidifier that has a filter, because I have been through so many of those humidifiers that don't have the filters, over the years, they get crusty and they fall apart. And when you have a filter, you're just gonna be able to remove all of the crustiness. What's it called when it the way it scales, or right?
Yeah.
But it's really nice when you have a filter because you can get away with using any kind of water versus a purified water, which can get really, really expensive, and it can be really difficult to constantly have that in your house to run through filters. Because like we run through an entire tank. We run through an entire one of these tanks in each room in our house. So we keep them in the 2 bedrooms. And then in the clinic here, we keep 1 in every room, and we'll run through a tank in a day if it's dry. So if you're running purified water in that stuff, it just gets crazy expensive. Now, if you have a system in your house and you don't have to worry about that, great, but I don't. And so it's really easy to destroy humidifiers if you don't have the right water. Okay, I'm gonna just show you what this one does because I do get questions on how to clean these. This is the filter we use. It's just generic. It's great. And you take it on the backside. So you're gonna see here, this is where it sits. And you'll just place it in and put it on the back side. This one is taken apart though. So what I did with this one, this came from my garage because I let them sit out there in the summer when we're not using them in the office. So these have been in my garage. So we're in the process of cleaning them up. So the timing of this was perfect. What I did here was I let it soak. So there's a piece here that you can flip. You take the whole top off. This whole thing came off of this. And again, if you have a different contraption, that's fine. But the key to know is that you want to use vinegar. I do not use bleach. It says to use bleach after this whole process. I don't want that in this whole thing. And vinegar is antibacterial. Like you're not going to have to worry about the cleanliness if you're using this. I let it soak. So I use 3 cups. I put it into here and I let it soak for 20 minutes. And then you can descale. You can wipe it all down. And they say to do this every week. Up to you what you want to do. It kind of depends on how much water is actually sitting and how you're using it. But I say once a week is great. You let it soak, but you can see here it's just soaking at the base, and that's all scaled because we're kind of redoing it for the season. And then you unload it, you scrape it, and you reload it with your clean water. And this particular piece tells you what the humidity is, and it is really important to keep it 40 to 60%. We were talking about this before we went live today. It's really important to keep it at a certain level in your house, and it really does decrease the incidence or the probability of dealing with some of these sinus ear infections or even dealing with viruses. It gets so dry in our state and most states in the winter. It's really important to keep it between 40 and 60%, which seems really high. It is, but it's really important. So I would say bedroom for sure, really important. And again, we keep them in here. We're talking all day, so it feels really dry. And so it's really nice having humidifiers in here. Do we have any questions about cleaning, about the humidifiers? Are we good? Okay. Maybe we'll just call it. If you guys do have questions after, let us know. We're here for you. This is definitely one of the hot topics that we get asked on the regular. So if it occurs to you tomorrow, next week, next month, let us know. Oh, yeah.
Question, what brand?
Oh, what brand? This is Honeywell. Oh, and that's a really good question. You won't find this in the pharmacy section. You'll find it with the vacuums. So if you're wanting something that doesn't fall apart, that is more of a household item, and you don't have to do it that way. But if you do, that's where you would find it, is not in the pharmacy section with like the little animal humidifiers. It's like back with the vacuums. And I do like Honeywell. I feel like we're on year 3 of using these, and I have 5 of them. I own 5. And they're fantastic. They're great. And again, they're easy to clean. Yeah, great question. Thank you. Anything else? That was a great last question. Okay, we're gonna wrap up. Lovely evening, you guys. Wishing you all well. Thanks for being here. We'll talk to you later. Thoughts?